Good day. My name is John Bergali. I live here in Menifee in Southern California. A little of my background. I came from the Philippines in 2015. I've been a nurse since 2004, but aside from being a nurse, I was also a physician in the Philippines, and I decided I wanted to take up nursing because I wanted to come and live here in the US. I came here in the US in 2015, started my practice as an ICU nurse in Florida, where I stayed there for about a year and a half. And I transferred here to California in 2016. I've been working in several hospitals in the ICU, but my current position is a ICU nurse here in one of the local hospitals here in Southern California. I've dealt with, I've been reading about psychotherapy. We've had this in our last lecture in MN661, and I've read the book of Shea and Corey. And what gives me a lot of anxiety, or makes my mind work, is what type of psychotherapy which will be beneficial for the patient. I know each patient, all our patients have different problems: anxiety, bipolar, different mood disorders, depression, patients with suicide. And I want to know what type of psychotherapy will be beneficial for these patients. We already know that we have different pharmacotherapeutics for different illnesses these patients are going through. But what bothers me is to know what type of psychotherapy approach would be better. Is it Rogerian? Is it, um, shall we use CBT in terms of treatment, existential therapy, Gestalt? When you read the books in MN661 classes, they give you a lot of options on what type of psychotherapy would be good. But once you're in front of a patient, trying to choose the right approach, trying to get the right questions out to be able to get the right answers from the patients is what bothers me. And I noticed that when we were doing the PCS Spark laboratory. So if you don't get the right question, then tendencies that you won't get the right answer. So I guess that's one of the things that bothers me is how do I approach the patient and what is the right question to ask to be able to get the right answer so that you can proceed with your treatment of the patient. Because I believe talk therapy plays an important role. Also does, medications play an important role also for treatment. But if you can win the trust of the patient, trying to reach out, trying to ask the right questions with psychotherapy, that will be a very big factor for the patient. So I guess what's important to me is what type of psychotherapy would be best for a patient. I think that's one of the questions that still goes to my mind, and I would like that to be answered with this class.